Hi. I want you to take a moment and step back into our childhood magical stories. Cinderella and Harry Potter. Now try to remember what do these two had in common. Well, they both lived tough childhood conditions. Think of Harry, forced to sleep in a cupboard down the stairs, and Cinderella, spending her days cleaning and managing the household. What they really faced, among other things, is child neglect. And as we say child neglect, we mean the ongoing failure to meet a child's basic needs. It has deep and chronic effects on children's physical, mental health, their development, and even their safety that can extend into adulthood. It usually comes in four forms based on the unmet needs. Either physical, when a child's basic needs of food, shelter, clothing, and appropriate supervision aren't met adequately. Educational, when a child lacks access to schooling or learning opportunities. Emotional, when a child lacks the basic emotional needs. And today, I'm going to focus on the fourth form, which is medical neglect. And it's when the child's fundamental needs of healthcare aren't met adequately. It often comes in two forms of failure. It's either the failure to notice the sign of illness, or it's the failure to follow the medical advice after it has been sought. These failures can seriously harm the child's health. That can be either immediate or on the long run. In fact, 9% of the child maltreatment-related fatalities in the United States are linked to medical neglect. And since children rely mainly on adults for these healthcare needs, parents are often held responsible for these failures. But what exactly defines failing to meet a child's basic healthcare needs? And is it always easy and clear to know when this line is crossed? Let's look at the first case. We have a 12-year-old boy who was recently diagnosed with type 1 diabetes and prescribed insulin as a treatment. On his follow-up visit, it was noticed, and the doctor noticed that he was admitted to the ER 3 times in the past year for his glucose levels. Although he was stable now, but the doctor also noticed that his insulin prescriptions has not fully been filled. So take a moment now and think of this case. Is this medical neglect? Well, some of you will say, apparently, according to the definition, the child didn't receive the medication, so it might be, it's clear. But what if I add some more details here? Let's look at the first scenario. We have the same 12-year-old boy coming in, but now we know that his mother is single. She has 2 other sick children at home that need medication. She took an extra job to be able to afford all these expenses. But her paycheck didn't come in yet, and as soon as she gets the money, she will get him the medication. So would you say that this boy is suffering from medical neglect? Take the second scenario. The same 12-year-old boy, but he's terrified of needles. Every time his parents try to convince him to take the medication, he starts yelling and shouting and refusing by any means to take the medication. The parents are helpless. They tried everything they can, but without success. So they decided as long as his case is stable, they won't push him further to avoid emotionally distressing him. So is this still considered medical neglect? Well, suddenly, the situation isn't as straightforward as it was at the beginning. And at the end, in all the cases, the boy didn't get the medical care needed, but the reasons behind that are different. These scenarios highlight exactly the challenges that we face in identifying medical neglect. The line between when a situation is considered medical neglect and when it's not always easy to draw, and it's full of gray areas. And these gray areas are because medical neglect is highly context-related, which means that we view each case with the surrounding circumstances. that can be also different in different cultures and communities. This is not the only challenge, but there is a lack of specific, practical, and clear definitions of what is medical neglect, which makes it even harder to develop a clear and practical assessment tools to identify it and address it. So despite its high impact on the child's health, medical neglect often takes a backseat in research and practice, what is termed as neglect of neglect. Our knowledge is also limited to the streetlight effect, which means we focus on the easiest to reach cases, usually poor families and the families who are known to the welfare system, while ignoring the harder to reach cases that for children that can also be neglected but never get noticed. Most of our knowledge is from professional perspective, specifically medical experts who focus on severe reported cases. But what about the cases that are less severe, that never reach the threshold of reporting? The focus is mainly on early childhood ages, assuming that they're highly vulnerable. So in fact, our knowledge is shaped on medical neglect is shaped from specific perspectives and from specific population. And if we want to truly understand this 12-year-old boy basic healthcare needs, we're missing a key piece in the puzzle: the children themselves. Their voices, their perceptions, and their experiences must be part of the whole picture. Too often, children and youth are neglected from discussions about their healthcare matters, although they are the ones who are directly affected. And the past 3 decades has witnessed an increased interest in involving children's voices in research. Children and youth are the expert in their matters, and research shows that when we engage youth, we get invaluable and nuanced insights into their needs that we as adults often tend to overlook. So in my study, I'm working to develop a youth-centered understanding of medical neglect. And to do this, I'm turning to Arab and Jewish youth between the age of 12 to 14 of the general population, and I'm integrating their perspective about medical neglect and basic healthcare need with those of healthcare professionals from different backgrounds and cultures. Here are some of the questions from the questionnaire that will ask children whether they consider a basic healthcare need. For instance, childhood vaccination, regular checkups when a child even is not sick, playing outdoors, and the presence of a parent when a child is sick. The questionnaire was developed based on professional perspectives, but I want to explore how youth perceive and prioritize each of these needs. The responses will provide us and cover gaps in our understanding of their specific healthcare needs and what truly matters to them. So by engaging youth, we'll gain a clearer understanding of youth basic healthcare needs. We will improve the existing definitions about medical neglect, and we will create a better and more accurate assessment tool to fit the Israel diverse communities. This knowledge will better inform policymakers and professionals from the healthcare to better address and ultimately prevent medical neglect. And if I succeed to do this, so hopefully Cinderella stories will stay only as a fairy tale. Thank you.